Welcome to the Sleep Sense Show. As always, brought to you by the Sleep Sense program, where podcast listeners can get a free customized sleep plan by going to www.sleepsense.net/listen.
Hi, I'm Dana. Welcome to the show. Way back in the day when I was teaching grade 1, I was often surprised, maybe even a little alarmed, by how late some of my students reported going to bed. And at the time, I knew nothing really about sleep, but I did think that sounded a little too late. It was basically when I went to bed, and I suspected that children probably needed more sleep than I did. Anyway, fast forward several years, and I do now know that is in fact true, that a lot of my students were not getting enough sleep. And, I think one of the things that I've learned over the years that I work hard to share with other parents is that children handle their fatigue differently than adults. And for a lot of children, when they're overtired or running sleep debts, they tend to become hyperactive and they have a hard time with focus, and their impulse control is a little off, and they tend to get quick to anger or rage. And all of those symptoms can and do look like a lot of the symptoms a child would have if they have ADHD or attention deficit hyperactive disorder. And I've been saying for years that if we monitored children's sleep schedules a bit better and we made sure that they were getting good quality, long enough sleep at night, that perhaps some of those symptoms would go away or at least become more manageable. And we know for kids, all the way from infancy to adolescence, children need about 10 to 12 hours of nighttime sleep, and that doesn't actually drop that much when they do hit puberty. It only drops down to about 9 or 10. So they definitely do need more sleep than adults. And if they get that every night, not just weeknights, but every night, that they do much better, and their behavior definitely improves. So I was really excited one day when I stumbled upon an article in the New York Times called Diagnosing the Wrong Deficit. And that was written by Dr. Vatsal Thakkar, who is a board-certified psychiatrist practicing out of Westport. And he is the clinical assistant professor of psychiatry at the New York University School of Medicine. And he specializes in diagnosing and treating mood disorders, anxiety disorders, ADHD, and sleep disorders. And what I loved about the article is it basically highlighted the fact, with studies to back it up, that sleep dysfunction is often overlooked when diagnosing psychiatric disorders or when also diagnosing ADHD. So I invited him to be a guest on our show today to discuss this issue with us and give us a little deeper insight into what could be causing symptoms of ADHD, how sleep plays a role, a very, very vital role in basically how children behave throughout the day, and what are some of the things we can be watching for, or perhaps some of the questions we should be asking our care providers when we're faced with this. It usually shows up in the school age area, preschool, or starting kindergarten or into the school years, where if your child is exhibiting any of those symptoms, it's usually brought to your attention. So what are some of the things that you should be asking about in this regard? And certainly, I hope we have highlighted today how important it is to look at both the length and the quality of your child's nighttime sleep. Dr. Thakkar is also the founder of an app called Reimbursify, which allows individuals to file out-of-network health insurance claims from their smartphone in about a minute. So definitely cuts out a lot of the paperwork. If you want to check that out, then please visit reimbursify.com. All right, without any further ado, I will turn over our interview from today. Enjoy. Hi, this is Dana, and welcome to the show. I want to welcome Dr. Thakkar with us today. Thank you for joining us.
Thank you for having me.
So, tell us, first of all, what was the inspiration or your motivation for writing the article, Diagnosing the Wrong Deficit?
So, for years prior to that, I had started specializing in adult ADHD through my job at NYU as well as in my private practice. And at the same time, in the around 2010 to 2012, there had been a lot of press, usually negative press, about how the rates of ADHD were rising, and many people, kids and adults, were being prescribed medication for ADHD, and no one could make sense of it. Typically the argument was doctors are overdiagnosing it. And given that I was in the field and on the front lines of a practice where I was seeing patients every day who fit into this category one way or another, it occurred to me, since I was always doing a pretty thorough sleep assessment as well as as part of my ADHD diagnosis paradigm, it was pretty clear to me that there were a lot of people who had sleep dysfunction as not only in combination with, but in some cases as the primary symptom complex that might even take a higher priority than ADHD. And once I started looking into the research data on this topic, I saw that it was being studied by different specialties, but it seemed like those specialties weren't necessarily communicating with each other. And so I thought I needed to write this to kind of bring it all together for people.
Yeah, that's great. And would you say that that's a usual process? I mean, I think I'm glad to hear that it's becoming a little more mainstream. I've certainly been in the sleep business for the last 15 years or so, and have noticed that it's trending that way, that more and more people are sort of taking notice and incorporating it into their practices. But would you say that you're a bit unique in that you include the sleep aspect of your protocol?
I think it is unique, and I came at it as someone who's been diagnosed with a sleep disorder, so it was personal to me and something that I know even not just medical professionals, but even psychiatrists would not spend enough time on, besides the typical questions around insomnia. But it doesn't take that long in a diagnostic interview to ask 3 or 4 basic questions that cover snoring, possible sleep apnea, cover restless leg or restless sleep issues, night terrors, sleepwalking, that sort of thing. And in addition to the typical insomnia assessment, and based on that, it can point you in a certain direction to get more information if needed.
Right. And I thought that was really interesting when I was reading the article. Can you tell us, if you don't mind, a little bit more about your particular struggle with sleep?
Sure. So probably since I was a teenager, I've had what can be considered hypersomnia. Not quite impairing to the point of affecting me. In fact, I got through medical school and residency without a diagnosis. But I was I could loosely call sort of a sleep addict. I could get a ton of sleep at night. I could take naps during the day. I often would shut my office door and take a 30 to 60-minute nap during the day and still never feel like I got enough sleep. And that can be a powerful thing, if you've never experienced it. Thankfully, I can say the last 10, 12 years, 15 years have been pretty much remission in that sense, in that I rarely, if ever, take naps, and I feel like I have normal sleep patterns again.
And yours was something, it's a form of narcolepsy, is that, am I correct in saying that?
Correct. So it's many people think of narcolepsy as uncontrollable sleep attacks, or people who could be driving or talking or eating and just unexpectedly fall asleep. And that's never happened to me. And that's also why I never thought I might have a sleep disorder like that, because even I, as a physician, thought narcolepsy is that sort of thing where people just accidentally fall asleep. But certainly there are people with narcolepsy in that sort of part of the spectrum, but the spectrum's pretty big in that people with excessive daytime sleepiness and what we call excessive REM phenomenon. For some reason the brain wants to promote REM sleep, whether it's being sleepy during the day or getting too much REM sleep at nighttime. And that's sort of the core foundation of narcolepsy, regardless of whether people can accidentally fall asleep. Mm-hmm. And so it was almost like living life sort of half in a cloud.
Right.
It always felt like I was woken up at 3 a.m. and I was sleep deprived, and I felt like that no matter how much sleep I had gotten.
Right. And one of the reasons why I just wanted you to touch on it a little bit is because I think a lot of people think, when we think about classic sleep disorders, apnea comes to mind. For most people, they understand what that is. But I think for the listeners out there, that sleep disorders per se can there's a spectrum of them, and it doesn't necessarily have to be, you stop breathing and that's the essentially the problem. There's lots of other things that could be going on that definitely require some investigation.
No, absolutely. I mean, though apnea is the most common sleep disorder, just by asking the right questions, I've found in my practice over the last 10 years that I've picked up maybe 40 or 50 cases of narcolepsy, and this is not just me. This is me suspicious that might be the case, and then sending them for a full sleep study, and then the sleep specialists confirming that diagnosis using the specific brain waves that occur in the condition. Mm-hmm. And so when you start doing that, it's a little bit frightening to think that, if I hadn't asked the right questions, then I would have missed this diagnosis and maybe just put someone on a stimulant thinking they have ADHD.
That's right. So let's talk a little bit about kids in particular. So first of all, for people that don't know a lot about attention deficit, or maybe they're just sort of stepping into that diagnoses, what are some of the tests, or what is the test or protocol if a patient comes in with a child who's potentially exhibiting some of the symptoms?
So the diagnosis can be made, it should be made in a structured way, ruling out certain things and ruling in the right set of symptoms and impairments. And so you want to rule out any medical or other psychiatric causes. And so on the medical side, it could be, some sort of infection. It could be food allergies sometimes, which can increase inflammation, which can slow down, cause some brain sluggishness. There can be other psychiatric phenomenon, whether it's depression or anxiety disorders or stress at home or stress at school. Someone really needs to tease out, do sort of a 360 perspective on a kid's life, and both at home and at school to see what's causing what, and to see if attentional impairment is really there, separate from everything else, arising possibly from ADHD, or if it's being contributed to by other phenomena. And in that process, I think doing this sort of quick sleep screening is a good idea, along with interviewing the parents and maybe contacting the school to see what's going on as part of this 360 assessment.
Right, right. And tell us a little bit about, for adults, when we're thinking, if I'm a sleep-deprived adult, I'm probably walking through the world feeling, low energy, brain fog, maybe scatterbrained. I might be feeling a little bit depressed. So those are kind of the typical symptoms that show up when an adult is suffering sleep deprivation. But what are the differences that show up in children?
So kids who are sleep deprived usually don't show sleepiness, so that's why it can be easy to miss. Kids who are sleep deprived will become moody and irritable and show anger and rage, and they can also become more hyper, fidgety, and have a shortened attention span. So, that's where it's kind of ripe to easily and mistakenly sometimes come to an ADHD diagnosis, because if someone's not feeling sleepy, it's hard to immediately think that they're sleep deprived. And that can certainly even happen in adults. One study I looked at showed that adults with undiagnosed sleep apnea, only 50% of them actually felt sleepy, excessively sleepy from that during the daytime. So half of adults don't feel sleepy either in that particular condition. I think the brain sort of adapts because sleep apnea can develop over time. It's not something that just hits somebody overnight. And so the brain slowly adapts by in different ways to avoid or to eliminate sleepiness. But other neurons take over and brain function can change, exhibiting different kinds of symptoms other than just typical sleepiness.
Right, that's right. Yeah, that's something I've been promoting for years, is that, children show it much different than we do, and hyperactivity is often a common symptom of overtiredness.
Right.
And I think, too, and maybe you can speak to that as well, when we're looking at sort of hyperactivity in general, sometimes it's as simple as just adding an extra hour of nighttime sleep to the child's schedule. And a lot of parents, and even when I was a teacher, I was constantly shocked by how late my students were going to sleep, and that they were only 6-year-olds. So I think, I'm excited that parents are paying more attention to the sleep needs of children, and they're not adults. They need far more sleep than we do. So if they're not getting consistently, 10 or 11 hours of nighttime sleep, it could be showing up in their daytime behavior.
Absolutely, and that's not even to mention the possible metabolic effects from sleep deprivation over time. So it can affect their appetite and their metabolism and their risk for becoming overweight and developing diabetes, and it's a bad recipe all around.
Mm-hmm, mm-hmm. And so if somebody comes to you and you sort of notice, what would be a couple of triggers, sleep triggers that would catch your attention if you were working with a child?
So things that would catch I ask everyone, adult or child, whether exactly how much sleep they get. Mm-hmm. When I have a parent there with a child who might be a teenager or so on, I'll get from the parent what kind of sleep history they've had. If they've had sleep troubles dating back to infancy or not. I'll try to develop a timeline in that regard. If this is somebody's, if there is something in their sleep history that's concerning, then to see if it's been there long term or if it has just something that developed acutely and more recently. And occasionally I will, the sleep specialists do this more often than I do, but using some sort of device to track activity level. Mm-hmm. And so you can, now with the wearables that we have, you can easily get a two-week chart on basically telling you how much time someone was in bed every night, to be a proxy indicator for the amount of sleep they're getting.
Mm-hmm. And how often, when I was reading your article, one of the the studies that you highlighted was talking about the children who went in to have their tonsils removed and sort of doing a follow-up year later on the symptoms that were showing up after the surgery had been performed. Can you talk a little bit more?
Right.
Is that sort of the typical is the tonsil issue? Is that sort of a typical sleep challenge that children have?
So, yeah, that was one of the studies that really got me thinking about this and was one of those aha moments that you think, okay, every specialist who deals with kids needs to know about this.
Right.
What happened there is that they interviewed kids and parents of the kids who were getting tonsillectomies, who were scheduled to get tonsillectomies. Now, the background there is usually if an adult has sleep apnea, we think of obesity, we think of lack of muscle tone, or someone who needs more exercise, sometimes thyroid problems in adults. For kids, especially if they're normal weight, it's usually an anatomical issue. So, parts of their body grow faster than others, and even my daughter was affected by this, where she had to have a tonsillectomy because she was showing mild sleep apnea and sleep dysfunction. But tonsils and adenoids anatomically are one of the biggest causes for childhood sleep apnea. And so they took this population of kids who was about to get a tonsillectomy, and this is sort of a random sampling. There was no psychiatric history here to speak of, and they found, I believe the number was in the low 20% range of those kids pre-tonsillectomy seemed to meet criteria for ADHD. So if a child psychiatrist interviewed those kids and was able to diagnose ADHD based on the symptoms they were showing and had shown over time. And then the kids had the tonsillectomy, and a year later they had a child psychiatrist again, a different child psychiatrist, and the doctors didn't know which patients were which in terms of who had a tonsil surgery and who didn't. But the rate seemed to drop in half. So it went from the low 20s to the low teens. Mm-hmm. And the only thing that had changed was they were 1 year post-tonsillectomy. Mm-hmm. So what we can infer, and obviously more study is needed to really lock this in as data, but what we can infer from that is the tonsil issue was creating sleep dysfunction, which was creating or mimicking an ADHD picture in half of those kids. That was significantly reduced and or eliminated by treatment for that sleep dysfunction, i.e. getting tonsils and or adenoids removed.
Right. Yeah, that's fascinating. That just goes to show, yet again, if we're not getting good quality sleep at night, it just trickles into every aspect of our life in a really powerful way.
Absolutely.
Yeah. So I've had, I've been working with kids for years now, and I sometimes get reports from parents who, let's say their children have been diagnosed with ADHD. They'll often say that they have trouble settling down, calming down, getting ready for bed, going to sleep on time. And I always wonder, it's kind of a chicken and egg scenario. Do they have the hyperactivity because they're sleep deprived, or, are they not sleeping well because they have this ADHD? Do you have any thoughts around that?
Yeah, I mean, it can be a tough one. I mean, I wish there was a magic scanner that would tell us, and then it would, the debate would be settled one way or the other, right? But for where it's really ambiguous, if it is ambiguous to tell, I mean, that's when perhaps a sleep specialist should be consulted. There's really no substitute for the gold standard of a full sleep study, although it takes time and it has costs. It's measuring muscle movements. It's attaching electrodes from head to toe. That's monitoring not only the brain but the whole body, and it usually does a good job of finding the levels of whatever possible dysfunction is there. If there's apnea, it can measure how bad it is, right? How many times an hour someone doesn't breathe, or if their oxygen level drops. If they have restless leg syndrome or that type of phenomenon, and basically what that does is that movement keeps people from going into a deep sleep. So even though kids might be sleeping, they're not getting restorative sleep. And that's often correlated with ADHD. A lot of people with ADHD also have restless sleep issues or restless leg syndrome. And funny enough, some people with ADHD who take a stimulant medication actually sleep better, and that might be the reason why that occurs. But it sort of depends, if when we quantify the symptomatology and compare them, and sometimes we have to experiment with different, like trying to treat one first and see how the other responds, or doing the opposite. Sometimes, we're stuck with trial and error to really figure out the diagnostic picture.
Right. And as far as the medication goes, could that, if it's, I don't know if it's taken close to bedtime or is an appropriate time to take their medication, or any of the medications either helping sleep or hindering it?
Certainly it depends. I mean, there are some non-stimulants for ADHD that can be given at night and can actually help people sleep better. The traditional ADHD medications are stimulants, and they should probably not be taken anywhere close to bedtime. I mean, maybe early mid-afternoon would be the latest. There are some other basic things that can be useful. I've gotten to the point of basically checking everyone for a ferritin level, which is a test of iron. And low iron is a I don't want to say a risk factor, but it aggravates both restless sleep and it aggravates ADHD because iron helps dopamine work better, and dopamine is essential. Proper dopamine functioning is essential for both ADHD and proper sleep.
Right.
And so there are some basic things, and you could also read into that, given that kids are now more iron deficient than they ever have been. I mean, could that be one of the contributors to some of this that we're talking about today?
Oh, interesting. I didn't know about the iron.
Yeah.
Okay, great. And how about, one of my big complaints, I think, and it's getting worse, unfortunately, is blue light and electronics too close to bed. I think both of those things definitely make it harder for children to wind down, to cue their bodies and their brains that sleep is coming. Is that something that you discuss with your patients?
I do. It's a challenge because nowadays even homework has to be done at a certain point, has to be done on a device, and kids have a lot more activity and they get a lot more homework. So sometimes it's a real challenge to get someone to be device-free starting at 8 p.m. When you try to want them to sleep by 10. I'm thinking more of a high school student, but
right.
But absolutely. I mean, there are fascinating studies on this too, where if you take a group of people and take them out camping without any artificial light, everyone gets sleepy earlier.
Right.
And so that should tell us a lot. I remember when we had a big hurricane up here in the Northeast, and we didn't have power for a week. And we basically, sat by the fireplace, and then we all went to bed by 8 or 9 o'clock at night. And it was almost like a little mini vacation.
Right. That's so true. All right. Well, so let's maybe just give everybody a couple of pointers. If they've got a child who there's some suspicion that maybe there's attention deficit disorder or lingering, or the thoughts been brought to the parents' attention, and they're going through the testing process, what are sort of the maybe top 2 or 3 questions to be asking your doctor or the psychiatrist that just, I think sometimes we just automatically assume as soon as somebody says this is what we think's going on, we go, okay, right, great, let's deal with those issues. But to just pause and sort of reflect and make sure that they're getting the best advice that they can possibly get from their care providers.
Sure. So part of it is predicated on the severity of of the consequences, right? So sometimes ADHD can present in a kid, and there's already been major consequences, and sometimes that will help make the diagnosis more clear cut because there's no other symptoms that could explain, as far as at least in our current knowledge base, that could explain the dysfunction besides ADHD. But good questions to ask are, what else could it be? Could it be anything else? And some of the things that we're talking about here, is there new stresses in the child's life? Has there been a change in their sleep, or has their sleep always been different or dysfunctional in some way? This iron question can be useful. One of my kids, the one I mentioned who had her tonsils out, we did check her iron, and her iron was low, so we thought that was also hurting her sleep. So she takes an iron supplement. And there can be other questions like that in terms of physical exercise. Some kids do well and can do well and possibly avoid medication if they get enough physical exercise. And looking at overall nutrition can be useful too. I think our diets have changed drastically in the last 40 years, and there's more research coming out about that in terms of how it affects the brain, and especially a child's brain. And that would be a place to start, in my opinion.
Mm-hmm. That's great suggestions. What about snoring? I've been telling parents for years that if children are snoring, it's definitely worth investigating.
Yeah, so my threshold on that's pretty low, and even for adults sometimes. So when someone is snoring, by definition, the sound is made by friction, because some tissue in the airway is rubbing together that shouldn't be rubbing together. Mm-hmm. And when there's friction in the airway, the body has to compensate by putting more effort forward to breathe. And when you're sleeping and you have to put forth more effort to breathe, it can keep you from getting that deep sleep, right? Because part of the brain has to be more activated to make sure you don't stop breathing. Mm-hmm. And I've even seen, there was an adult I referred for a sleep study who didn't have sleep apnea, but the sound of her own snoring was waking her up to a mild level, right? So she didn't know she was waking up, but it was pulling her out of deep sleep from the sound of her snoring. So basically, anything that, snoring or otherwise, anything that can disrupt that deep sleep is and can be problematic. And so, especially if I have someone who comes in and let's say there's a change in their functioning, whether it's an adult or a child, let's say they were doing okay, but for the last 6 months, maybe someone's suspecting ADHD. And then if I find out that they are snoring, or especially if they started snoring just in the last year, then that's what I go with and investigate before anything else. I want to rule out, was this a change in anatomy or in sleep breathing that is creating this issue?
Right.
So we look at time courses and see what matches up, as well as relevant symptoms like this that coincide with the attentional problems.
Okay, that's good advice. Yeah, and I think, for everyone listening, the same good sleep hygiene. I mean, good sleep hygiene is going to help everybody, whether you've got attention deficit disorder or you don't. So making sure that your kids are going to bed at the same time every night, have a nice little routine that's relaxing and screen-free right before bed. So these are all things you can do no matter what you're dealing with, that's going to definitely improve behavior, improve function, adults, kids, babies, you name it. It's all good stuff. So,
absolutely.
Yeah. So I just want to thank you so much, Dr. Thakkar, for being with us today. And tell us a little bit. I know you're working on something pretty cool that you wanted to share with us.
Sure. So, as I said earlier, I've been working with ADHD patients for a long time, and as well as a lot of people with sleep disorders. But really, it was one of my patients with ADHD who needed help filing his insurance claims because I'm an out-of-network practitioner, and so I started helping a bunch of patients with that, and pretty quickly saw that this could easily be an app. And so, for the last year and a half, I've developed, and we just released an app to help patients file their reimbursement claims, and it's called Reimbursify. So I hope anyone who needs an app to file their insurance claims would download it and check it out.
And that just makes it easy to do right on your device. Is that right?
Right on the device. No more printing, mailing, filling out forms. It's all pretty much from the smartphone.
Oh, that's great. I mean, any way we can make insurance easier, I'm on board with that.
Absolutely. Yeah, part of it is just keeping them from making it harder.
Right, exactly.
as much it is making it easier.
Right. Awesome. Well, we'll include a little bit more information about that so people can easily find it. But again, thank you so much for sharing your expertise with us today.
No, thanks for having me on. It's a very important topic.
Awesome. Thanks so much. Bye-bye.
Bye.
Thanks so much for listening. For more great tips on helping your child sleep through the night, remember to subscribe, rate, and review the show on iTunes or Stitcher, and never miss an episode.